Let me post in all the WhatsApp study groups, doctor, that the session is starting. So we start the class in another 2-3 minutes. Please wait. Good evening, everyone, and welcome to today's wonderful evening. I thought it'll be 3 o'clock, then it got late, and at least by 6:15 we are able to start. So I hope you all have downloaded the Score app and had an opportunity to solve the 200 questions. So solving a NEETPG mock test is the first step. But once you solve, knowing where are your mistakes, what are the learning gaps that you need to fill, everything should happen, then that gives the best yield of this exercise of taking the NEETPG full-scale grant test. Thank you all for joining this discussion, and at least 150 questions let us discuss, and you keep answering and punching your answers actively. That is the best way to do the revision, right? And to make it an interactive session. So today is 28th August, and still we have about fairly about 120 days before the exam. And in the next 120 days, we are going to have 50 full-scale NEETPG mock tests and the discussion. So let's make the great beginning, Doctor. Can the online students can punch whether the voice is loud and clear for all of you? And please don't forget, tomorrow we'll have a very long session, 4 to 5 hours of session. Tomorrow and day after tomorrow, preferably we'll try to do the discussion afternoon, uh, 1 o'clock to 6 o'clock, and try to finish biochemistry. So we had been prolonging biochemistry since a long period of time. Can the online students can punch whether the voice is loud and clear for all of you, Doctor? So let's make the great beginning. Good. Now, what is the commonest site of implantation, ectopic pregnancy? It is the ampulla of the fallopian tube, which is called the safety muscle of the tongue, Dr. genioglossus, which is that fan-shaped muscle. And hypoglossal nerve, all muscles of the tongue are separated by hypoglossal nerve, except, this is a favorite question, except the palatoglossus, which is supplied by the pharyngeal plexus, is what you need to remember. Musculocutaneous nerve, all the brachial plexus, from where the nerves arise, is a favorite question. It is a lateral cord. So 3 muscles arise from branches of the roots. Naruto serratus anterior, dorsal scapular nerve, and muscular branches to the 3 scalene muscles, they all come from the branches from the roots, is what you need to remember. Suprascapular nerve, subclavius nerve, they are the branches from the trunks. From the medial cord, you get medial head of median nerve, medial pectoral, ulnar nerve, medial cutaneous nerve of the forearm, and the medial cutaneous nerve of the arm. Then from the lateral cord, remember LML Vespa, lateral pectoral, lateral head of the median, and the musculocutaneous arise from the lateral cord. And rats, radial, axillary, thoracodorsal, and subscapular, they all arise from the posterior cord, is what you need to remember. Thank you, Vikas, for the feedback that the voice is clear. Good. Now, the fracture of the surgical neck of humerus leads to the loss of abduction movement of the shoulder joint. Why? You all know very well, abduction is because of the axillary nerve, right? Up to 15 degrees, abduction is by supraspinatus. 15 to 90, abduction is by deltoid, supplied by axillary nerve. Axillary nerve supplies 2 muscles, doctor. Deltoid, teres spina. Deltoid, teres spina. Beyond 90 degrees, the abduction is by the serratus anterior, is what you need to remember. Fracture neck of the fibula produces the foot drop because of common peroneal nerve injury. So in the anterior tarsal tunnel, it is a deep peroneal. Jogger's foot is medial plantar nerve. And tennis leg is gastrocnemius and soleus strain, is what you need to understand. Where is the permeability of the water is maximum? It is the thin descending limb of loop of Henle, where the permeability is maximum. Whereas thin ascending limb of loop of Henle and the thick ascending limb of loop of Henle, entire ascending limb of loop of Henle is impermeable to water. Similarly, initial part of the distal tubule also impermeable to water. That is what you have to emphatically remember, doctor. Very good. Shireen Peterson and many more. Please keep punching that your answers, if you are punching your answers, doctor, right or wrong, you are actively involved rather than being a passive listener, right? So those who are not the part of the WhatsApp study group, today only you become the part of the WhatsApp study group. Here I am typing the Phone number 900868 So please inform your friends also to come and join in the WhatsApp study group. 24x7, we are in the mission of preparation for the NEETPG. Once more, only if you are thickly committed for becoming a NEETPG topper, you will survive our WhatsApp study groups. Because even midnight, 2 o'clock also, we will be discussing the questions, etc., etc. So that is the reason. What I'm trying to tell you is, be a part of cohort, a group of mavericks, maniacs who wanted to win the NEETPG exam. So that's the reason. Be part of our WhatsApp study group. Download the Score app, and you have 30,000 MCQs, 600 hours of video content, and also the PowerPoint slides, everything available that we discuss, along with 50 full-scale grant tests. Then every day, daily, 3 hours, I make it a point to do a live YouTube free broadcast. But the only thing is, after the session is over, we remove the video and then upload that into the Score app. All right. So, doctor, study a little every day. And you don't need to study a lot. 54,000 high-yield facts are there. I created and compiled that into 1,500 pages of notes. I will courier it to your home. So each page will have around 10 paragraphs and about 30 points. So already if you know that point and can remember that, no need of going to video. But if you get a feeling that I need explanation for that, then you go to the Score app and you have the video. All right. It's very easy to prepare. Second round, first round, you will take about 500 to 600 hours to master these 1,500 pages. After that, every 100 hours, 150 hours, you will start doing revision, right? And you don't need any other material, vast study material, nothing. Entrance is what examiner want, you should know. What examiner want, precisely you should answer. Examiner will put the edge of the knife on your neck, on the jugular. You should be in a position to give the correct answer, go to the exam, hit it, and then emerge as the topper. It's very simple. All right. So let's continue our discussion, doctor. Water ascends like fountain because it is not reabsorbed. All ascending limb of loop of Henle is basically impermeable to water. Now, in the distal convoluted tubule, how does sodium absorption occur? Typically, it is aldosterone that lead to the absorption of the sodium. Once more, DNA polymerase 1, polymerase 2. These are all the favorite questions of the examiner, doctor. DNA polymerase 1 does not initiate any new RNA primer synthase. It is done by the primase. DNA polymerase has polymerase activity, 3,5 exonuclease activity, 5,3 exonuclease activity is what you need to remember. Helicase unbinds the double-stranded DNA into single strand. Single-strand binding proteins prevent a premature annealing of the double-stranded DNA. DNA primase initiate the synthesis of the new RNA. DNA polymerase 1 excises the RNA primer, fills the gaps between Okazaki fragments. And polymerase 3 synthesizes the DNA, and the primase initiates the synthesis of the new RNA primer. So all these enzymes, what do? You need to be 100% sure. So if you take biochemistry, doctor, totally biochemistry, I give you 50 pages notes. There are 500 paragraphs and 2,000 points that you need to master. So today only order for your copy of 1,500 pages of high-yield facts notes. Now, The only output from cerebellar cortex is Purkinje cell. Purkinje cells send inhibitory projections to the deep cerebellar nuclei. Now, doctor, whenever nociceptive stimulation of the skin you do, you elicit a Babinski sign. So you get a flexor withdrawal reflex. Now, these are all glycosaminoglycans. Chondroitin sulfate, hyaluronic acid, heparin, not the chitin. Chitin is a polysaccharide formed from N-acetyl glucosamine. Xanthin oxidase. It can be inhibited by allopurinol, febuxostat, and it converts xanthin and hypoxanthin to uric acid. They're all true. It has got molybdenum, not the zinc, is what you need to remember. Which metabolic pathway occur in cytosol, which in mitochondria, and which both of them? So fatty acid synthesis, cholesterol synthesis, pentose phosphate pathway, they all occur in the cytosol. So glycolysis, glycogenolysis, glycogenesis, HMP shunt, fatty acid synthesis, bile acid synthesis, cholesterol synthesis, the only two lysis that occur are glycolysis and glycogenolysis in the cytosol. Beta oxidation of fatty acid, electron transport chain, Krebs cycle, oxidative phosphorylation, they all occur in the mitochondria, is what you need to remember. Whereas some enzymes of urea cycle are in mitochondria. 3 enzymes are in mitochondria. All the remaining are in cytosol. So also gluconeogenesis, steroid synthesis, sorting of the protein synthesis, they all occur in both mitochondria and the cytosol, is what you have to emphatically remember for the tomorrow's exam. Which amino acid contributes for most of the proteins to absorb the light in the region of 280 nanometers? Tryptophan. So aromatic amino acids are the only amino acids that absorb the light. Tryptophan, tyrosine, phenylalanine, histidine, they all will do that. Both the Km and also the Vmax are altered by uncompetitive. All of you know competitive, non-competitive. There is one more type called as uncompetitive, is what you need to remember. In competitive, Vmax is same, Km is increased. In non-competitive, Vmax is decreased, Km is unaltered. Whereas uncompetitive, it is also called anti-competitive. Whenever an enzyme inhibitor binds only to the complex formed between enzyme and substrate, that's called uncompetitive. So typically, whenever uncompetitive inhibitor is there, Km is lowered and also Vmax is lowered. Both of them are lowered, is what you need to remember. Now, hemolysis on blood agar media. This is another favorite question, doctor. Alpha hemolytic, beta hemolytic, gamma hemolytic, you need to be very sure. So beta hemolysis is a feature of Streptococcus pyogenes, Streptococcus galacticus, aureus, Staphylococcus aureus, Listeria, Bacillus subtilis, they all are beta hemolytic. So microbiology and immunology, we discussed in totally around 600 paragraphs. 3,000 points are there. I have given around 60 pages notes. Out of the 1,500 pages notes that I courier to you of the high yield facts, 60 pages are dedicated to microbiology. All right. But the question is, how much you revise within this 60 pages, reproduce an exam, lot of lists, dirty lists that often we forget are there. So you need to be very sure about. So, doctor, alpha hemolysis, Streptococcus pneumoniae, viridans, mutans, sanguis, and enterococcus. When do you diagnose with Vidal test? Salmonella paratyphiae. Whenever the antibody titer of both TIVO and TH are raised, and a rising titer of fourfold or higher in an interval of 7 to 10 days is more meaningful. So you need to do 2 tests and see the rising titer. And for brucellosis, only the O-somatic antigen is used. Poliovirus, icosahedral symmetry, interference phenomena, and picorna viridae. So what is meant by interference phenomena, doctor? Multiplication of one poliomyelitis virus lead to the inhibition of the multiplication by other virus of a different immunological type is called interference phenomena, which is caused by polio. Now, influenza, HIV, adenovirus, they all can be cultured except Norwalk. So that is the reason antigen detection, immune electron microscopy are the ones which are used for Norwalk, and nucleic acid amplification. Cryptococcus neoformans, it's a monomorphic fungus. Urease positive, it causes meningitis in AIDS. It is more prevalent in the pagan infested areas. What are neurotropic organisms? Toxoplasma, Naegleria, and Plasmodium falciparum, and Balmutii. These are all called neurotropic organisms, is what you need to remember. Orphan diseases, Wilson, cystic fibrosis, familial hypercholesterolemia. So any disease that affects very small percentage of population is called orphan disease, basically. Now, doctor, volume of distribution of the drug. What are the factors that affect it? The degree of plasma protein binding. If a drug is highly plasma protein bound, it can't leave the blood vessel into the surrounding adipose tissue. That's the reason its BD will be smaller. Similarly, the fat lean body mass ratio, the PK of the drug, they're all the deciding factors. Sotalol, not only beta blocker, but also a potassium channel blocking activity. So, Evideron, Sotalol, Beryllium, they all three come under the class 3 among the antiarrhythmics. Church-Strauss syndrome can occur in the people who use the leukotriene antagonist Gefir-Lucast is what you need to remember. So very good to see 13 online classmates on this Sunday patiently attending the class. Very good, doctor. So in the past 23 years, some of you are only 23-year-old. In the past 23 years, almost all every Sunday, 1,000 plus full-scale grant tests I might have discussed in the past 23 years. Sometimes with a large crowd of students, 300 to 400 sitting before me. Sometimes only one student sitting before me, and with online students. What I understood is, when you take the grant test every Sunday, taking is not enough. Reflecting onto it, having a discussion on it, and then deciding these are the 10-15 topics we shall improve. And next time when once more a grant test is conducted, let us do better. Once you elicit that introspection, then the grant tests are most useful. All right, doctor. So please download the Score app. In the Score app, you have every week one new grant test, and there is a discussion. And all these questions, their explanations, everything will be made available in the Score app, of course. So, doctor, These are all bound to the alpha-1 acid glycoprotein. So, except the barbiturates, so any pregnancy, certain drugs, certain diseases, particularly HIV, they all will affect the plasma levels of the drugs. This alpha glycoprotein, alpha-1 acid glycoprotein, it is a primary carrier of all the basic positively charged drugs, whereas albumin carries all the acidic drugs. So there is a big list. If you have energy, try to remember, especially beta blockers, prazosin, lidocaine, bupivacaine, quinidine, they're all alpha-1 acid glycoprotein bound. Protease inhibitor is nelfinavir. So you should know what are NRTIs and NRTIs, etc. Thymidine analogs, zidovudine and stavudine. Cytidine analogs are lamivudine and emtricitabine. Guanosine analog is abacavir. Adenosine analog is diadenosine and tenofovir. Then you have nucleotide analog reverse transcriptase inhibitors like tenofovir and edifovir. Non-nucleoside are efavirenz, nevirapine, delavirin, and etravirin, and rilpivirine. And all virs, sakinavir, nelfinavir, indinavir, atazanavir, ritonavir, tipranavir, they're all the protease inhibitors. Type 1 helper T cells are secrete. What is a secrete? Interleukin 2. So this interleukin structure, one MCQ, emerges in every NEETPG exam, a little bit memory-based question. IL-1 causes fever, IL-2 T cell stimulation, 3 bone marrow, 4 is IgE, 5 is IgA. Somehow you need to make a way to remember. Hope I'm not going too fast, because unless I go at this speed, right, Doc? I can't be able to complete all the 200 questions. That's the reason it looks little speedy. But what I advise you is take the mock test on the score app before you join the discussion. Then suddenly the speed you can catch up, right? So Monday to Saturday, every day 3 hours when we discuss, we go little slowly, casually, and joyfully. Sunday grand test means we need to go very fast. All right. So hope, apologize me if I'm too fast. In addition, you have muscular weakness, pigmentation, hypotension, etc. Striae is a feature of Cushing's. Liposomes transport the lipoproteins. Rosal bodies are seen in myeloma cells. Iron deficiency, whenever it is there, typically long duration, if it is there, then all other things are true. But reti count increases only after therapy. Otherwise, reti count doesn't increase. That's the point. In megaloblastic anemia, there is an increased cellularity. The bone marrow is megaloblastic and hyperplastic. In India, you can dig the dead body and once more redo the autopsy, no time limit. Collection of the blood for toxicology is taken from the heart. Arborescent burn is what you get whenever the lightning strikes the individual, which is not sexual perversion. So basically, sexual offenses are divided into sexual perversions, unnatural sexual offenses, and natural sexual offenses. Perversion means complete satisfaction without intercourse. There is no penis entering into the vagina. That is sexual perversion. Sadism, masochism, fetishism, that is wearing the women wear Transvestism. Fetishism is uh, a guy appreciating the footwear of a woman, right? Then voyeurism, that is storm peeping. Frotteurism, touching and getting satisfaction. Tribadism, lesbianism, sodomy, bestiality. In all this, there is no intercourse, sexual perversions. Then incest, rape, and adultery are called natural sexual offenses, whereas sin of Gomorrah, that is buccal coitus, fellatio, with the tongue, oral stimulation of the penis, cunnilingus, that is oral stimulation of the female genitalia, they all come under unnatural sexual offenses punishable under section 377 of the IPC is what you need to remember. Now, hemodialysis, what are dialyzable, non-dialyzable poisons? This list, doctor, you need to keep in your mutti. So, low molecular mass, high water solubility, low protein binding, long half-life, small volume of distribution. Those things which have this are dialyzable. Ethylene glycol, procainamide, methanol, isopropyl alcohol. Lithium is dialyzable, ethanol is dialyzable, theophylline, salicylates, they're all dialyzable, is what you need to remember. Which anti-epileptic renal stones are seen, doctor? Topiramate, which is used to treat the epilepsy. Typically, topiramate is indicated to treat Lennox-Gastaut syndrome, and that lead to renal stones. Then tissue plasminogen activator. Typically, there are a list of contraindications you need to know, doctor. Any sustained BP more than 150. Platelets less than 1 lakh. Glucose less than 50 or more than 400. I leave the literature for you. But remember, contraindications for thrombolysis, you need to be very sure. In lateral medullary syndrome, there is an impaired pain and thermal sense in the contralateral side of the lesion, not ipsilateral. Contralateral ataxia with third nerve palsy is a feature of clot syndrome. So you should be very sure what are all the things that occur in clot. Dentatorubral, the dentate nucleus of the cerebellum to the red nucleus, dentatorubral fibers, contralateral ataxia. Corticospinal fibers, contralateral hemiparesis. Corticobulbar, contralateral hemiplegia of the lower facial muscles, tongue and shoulder. Then oculomotor, ipsilateral oculomotor palsy. This combination is called Clot's syndrome because of the infarction of the midbrain is what you need to remember. Binswanger's disease is not reversible. It is an irreversible dementia. Pick's disease also irreversible dementia. Dementia with Lewy bodies, Huntington's disease, Creutzfeldt-Jakob, multi-infarct dementia, amyotrophic lateral sclerosis, irreversible causes of dementia. Give me 5 minutes voice break, doctor. I'll just go and pick up a water bottle and come. Please stay online. So, doctor, welcome back to the session. Now, meningitis, lymphocytic pleocytosis with a low blood glucose concentration. So, you should remember that fungal, listeria, TB, all of them will lead to the development of lymphocytic pleocytosis. Whereas pyogenic bacterial meningitis is there, no, doctor? Bacterial meningitis, typically, there's a predominance of neutrophils, is what you need to remember. Caricum is a mid-diastolic murmur. Whenever there is a acute rheumatic fever, the mitral valve has an inflammation, mitral valvulitis. So typically it leads to a short mid-diastolic rumble that disappears the moment valvulitis improves, is what you need to remember. Hyperkalemia, tall T waves, decreased P wave amplitude, widening of QRS, they are all seen with hyperkalemia. But U waves is a feature of hypokalemia. So the first sign of hyperkalemia is peak T wave, the moment potassium levels are more than 6. Later there is a prolongation of PR interval, the moment the potassium is more than 7. And absent P wave with a widened QRS complex is a feature of 8 to 9 milliequivalents per liter. So beryllium, flecainide, ibutylide, dofetilide. So if you take class 1A, 1B, 1C, quinidine, procainamide, disopyramide is 1A, lidocaine, mexiletine, phenytoin is 1B, flecainide, encainide, and propafenone is 1C, is what you need to remember. In constrictive pericarditis, there's a prominent Y descent Kusumal sign. Kusumal sign means normally at the time of inspiration, there is an increased venous return, and that enters into the heart. But if there's a constrictive pericarditis, heart is not ready to get filled. That's the reason normally during inspiration, the collapse which you see in JVP because of filling into the heart is not seen. And the JVP remain prominent even during inspiration. That is called Kusumal, which is a feature of constrictive pericarditis. Pericardial knock will be there, is what you need to remember. Pulsus paradoxus is more a feature of cardiac tamponade. Cromolyn sodium is a mast cell stabilizer. In allergic bronchopulmonary aspergillosis, peripheral bronchiectasis, it is a central bronchiectasis, not the peripheral bronchiectasis, is what you need to remember. So there is a diagnostic criteria for ABPA in allergic bronchopulmonary aspergillosis. You get bronchial asthma, pulmonary infiltrates, peripheral eosinophilia, etc., etc. In HIV, you get FSGS. In Bartter syndrome, there is no hypertension. Bartter syndrome is an inherited defect in the thick ascending limb of loop of Henle. So there is a hypokalemia with a normal to low blood pressure. That is what you need to basically remember. About 85% of the infants with Bartter's, they have hypercalciuria, and in the kidneys, they develop nephrocalcinosis, is what you need to remember. A 32-year-old has a fever, sore throat, and a rash on using amoxicillin. It is Epstein-Barr virus, infectious mononucleosis. If you happen to do beta-lactam antibiotics that lead to an allergic reaction in the form of a maculopapular rash, is what you need to remember. Immunocompromised patient. I'm really, really happy to see 17 online classmates. Very good, doctor. So, immunocompromised patient develops fever, rash over his face, chest. The rash is being shown to you. He has a cough. X-ray is being shown to you. What is the likely diagnosis? The rash is the chicken pox rash, varicella, which lead to pneumonia. A 70-year-old complains of fever, the pain in his knee, as what you are able to see. And the arthrosynthesis shows septic arthritis, 200,000 leukocytes. So what do you want to order for? You need to order for a gram stain and the culture of the joint. So gonococci can cause septic arthritis, but generally urethral culture in the absence of urethral discharge will not be helpful. Gout is unlikely possibility. So the most likely possibility is acute septic arthritis is what you need to remember. A 43-year-old from Calcutta with diabetes, cardiomyopathy, and the radiograph is showing pseudogout, calcium pyrophosphate crystal deposition. That is a feature of hemochromatosis is what you need to remember. 38-year-old working in the bank in Aurangabad complains of aching all over. Anywhere you touch, there is a tender point. Multiple tender points is diagnostic of fibromyalgia. So how do you want to treat it, doctor? Tricyclic antidepressant like amitriptyline is the one which is given in the night is what you need to remember. An elderly male presents with pain in the shoulders and the hands, ESR is high, and the history includes transient blindness and unilateral headache. What's your diagnosis, doctor? Polymyalgia rheumatica. It is the other end of the spectrum of the giant cell arthritis is what you need to remember. 68-year-old from Vijayawada has 12-year history of symmetrical polyarthritis. No hepatomegaly, WBC count decrease. So, Feltes syndrome, what is the triad, doctor? Rheumatoid arthritis, splenomegaly, and leukopenia. That's what you are able to see in this case. Long-standing COPD develops an insidious onset of the aching in the distal extremities, particularly the wrist bilaterally. There is a 5 kg weight loss. The skin on the wrist is warm and erythematous. There is a bilateral clubbing. Now you have seen the radiograph. So what is your answer, doctor? This is hypertrophic osteoarthropathy, which can occur with any intrathoracic malignancy, suppurative lung disease, congenital heart problems, any of them can be responsible. Now, you need to get a chest X-ray because two reasons for hypertrophic osteoarthropathy are there in the chest. Either a lung abscess or a malignancy. That's the reason chest X-ray should be the initial investigation is what you need to remember, doctor. 30-year-old software employee presented with fever, then gram-positive cocaine clusters. So it is a Staphylococcus aureus. So cavities forming in the lung because of the necrosis is the feature which is caused by Staphylococcus aureus is what you need to remember. 43-year-old past medical history without any past medical history, 3-day history of fever and shaking chills, 15-minute episode of rigor, non-productive cough, anorexia, chest X-ray is shown. Now, doctor, the sputum is being shown. So the gram stain revealed gram-positive diplococci, numerous WBCs. So Streptococcus pneumoniae with lobar pneumonia is the most likely diagnosis. Acromegalic patients have a high risk of developing colonic cancer. In hypocalcemia, QT become prolonged. You don't need insulin for the brain to pick up the glucose because brain has studied our high yield study material. It knows to pick up the glucose without needing insulin, right? So you too study our 1500 pages notes with 54,000 high yield facts like brain. without needing coaching, without needing any insulin, you will get the top rank. Right, doctor? Next, bromelainitide. So it suppresses glucagon, it reduces postprandial hyperglycemia. Should not be used in gastroparesis because it itself leads to gastric emptying. So bromelainitide is produced by the beta cells of the pancreas along with the insulin is what you need to remember. So what is SIADH, doctor? Very important. SIADH is defined by hyponatremia with high urinary sodium excretion. Why? High urinary sodium. So whenever there is no ADH production, whenever there is too much ADH production, all the water is reabsorbed, doctor. And that increases the plasma volume. That will stretch the atria. And atria in turn will release atrial natriuretic peptide is what you need to remember. And that lead to the development of natriuresis. That is the reason the definition is hyponatremia with a urinary sodium more than 20 milliequivalents per liter defines the SIADH is what you need to remember. Hypothyroidism, medicine and Cushing lead to the development of the proximal muscle weakness. Now, this is the mother of all questions, doctor. What are the good and bad prognostic factors of ALL? You need to remember the list. Age less than 1, T922, Philadelphia chromosome, 411, translocation of 814, they're all bad. Hypodiploidy. Similarly, what lead to good prognostic? Some other way you need to bookmark this in the score app for the last moment revision, and definitely one question is going to come from this doctor. Dennis Drash, Wilms tumor, renal failure, male pseudohermaphroditism is Dennis Drash. Wager syndrome is Wilms syndrome. Aniridia, genitourinary abnormality, mental retardation. What is Beckwith-Widman syndrome? Hemihypertrophy, macroglossia, visceromegaly. These three syndromes, Dr. Dennis Drash, Wager, and Beckwith-Widman. Short to come in the tomorrow's exam. Transient myeloproliferative disorder, Down syndrome kids are prone to develop AML. Standing without support. You need to be very sure that various developmental milestones, standing without support happens at 12 months. So if you are from Hyderabad, doctor, please come to our Nampalli center in Hyderabad. We have a learning center, nicely air conditioned. You can even study, use it as a reading room. We will give you the actual printed question paper with explanatory booklet. That is the best way to do every Sunday grand test. Of course, if you're not from Hyderabad, anywhere in the world, Score app, download the Score app and you have the mock test published every Sunday, early morning. And by the time you wake up, your test is ready, put an alarm, and disciplined way, you try to finish the 200 MCQs and check what is your score, what went right, what went wrong. And in the afternoon, you have Dr. Murli Bharadwaj to sit with you and do the discussion of the questions. And the end of the day, make sure what topics you need to improve every mock test. All right. In the month of December, by the time we finish Monday to Saturday, all the 600 hours of revision of the 54,000 high yield facts. So in December, every alternate day, we will have a full-scale mock test discussion, Almost 30 mock tests we will have in the last 30 days. Until then, every Sunday. So totally 50 mock tests you get when you join with us. So please feel free to call our helpline 9000 868-356 to join. For 50 grantors, 30,000 MCQs practice, 54,000 high-yield facts in 1,500 pages notes, along with 600 hours of video lectures point-wise made available, and daily 3 hours of live broadcasted session. All this made available to you for whatever price you want to join for. So please do call our helpline and join. So, doctor, about the various developmental milestones once more. Social smile is 6 weeks. Smile at his mirror's image 5 months. Stranger anxiety by 7 months. Peekaboo is by 6 months is what you need to remember. 15th percentile of head circumference means 15% of children have head circumference less than that. A child recently learned to eat with spoon without spilling, to dress and undress herself with supervision, to understand that she is a girl. By when do we understand, doctor? Between 2nd to 3rd year. And when will you understand you are a boy? In MBBS 2nd year to 3rd year. Now, what is true about beta thalassemia? In beta thalassemia, there is a decreased osmotic fragility. Hereditary spherocytosis, increased osmotic fragility. Persistent bleeding from umbilical stump, factor 10 deficiency you should suspect. Late onset hemorrhagic disease. Typically is more common in the breastfed infants because breast milk is poor in vitamin K. Heliotrope rash, dermatomyositis. Tinea versicolor affects back, shoulder, chest. It's caused by Malassezia furfur, tinea versicolor. You should also remember spaghetti meatball appearance when you do the culture is what you need to remember. Toxic epidermal necrolysis, oxycam, sulfonamide, aminopenicillin, all of them are responsible. Glucagonoma lead to necrolytic migratory erythema. Hypertrichosis is caused by the alpha blockers. Is not caused by alpha blockers, but minoxidil, cyclosporin, diazoxide lead to hypertrichosis. Cerebral vasodilation is a feature by enfluorine, isoflurane, and halothane. How will you prevent oculocardiac reflex, doctor? Typically, atropine, retrobulbar block, deep anesthesia, they all are used in order to prevent the oculocardiac reflex. In porphyria, you can't use barbiturates. Diethyl ether stimulates the sympathoadrenal axis. If 50% nitrous oxide is inhaled for 3 days, that lead to megaloblastic bone marrow. True versus pseudo hallucination. One of the favorite questions, doctor. True comes from outer subjective space. It is as clear as normal stimuli. It cannot be controlled with one's will. Anytime it can occur and intrusive. And insight is not there. He doesn't know that he is hallucinating. Insight is not there in true hallucination. Delirium. Sleep is disturbed. Sleep reversal will occur. Ganser's syndrome. What is meant by Ganser's syndrome? Almost approximate answer will be given instead of the correct answer. Suppose if you say 2 into 3, he won't tell 10 or 20. He will tell 5. 2 into 3, he will say 5. That's called Ganser. So it is delusional and it's not a delusion. It can be seen with conversion symptoms, confusion, approximate answers. And hallucinations, not delusions. They are the features of Ganser's syndrome typically seen in prisoners, right? Similarly, if the CBI or enforcement department also calls a politician, he will become Ganser politician. He'll give approximate answers, which is not right. A 23-year-old lady married 1 year back, 6 months history of intermittent episode of altered sensorium. So all this satisfy to call that as epilepsy. Whenever nocturnal episodes are there, very classical of the true seizure disorder. Then, what is your name? Sheila. What is your house? Sheila. What did you eat? Sheila. Sheila ki Javani. There is a song, no? Notorious song. So, for everything he is answering the same. Then, that is called perseveration. Perseveration is seen whenever there is a frontal lobe tumor or schizophrenia, frontotemporal dementia, or catatonia is what you need to remember. How do you know whether it is after you give radiation, if the lesions appear, is it radiation necrosis or any recurrence and post-surgical change? For that, you need to do PET imaging. Atlantoaxial junction is best appreciated in odontoid view is what you need to remember. Claustrophobia, pacemaker, ferromagnetic clips, they're all contraindications, not the pregnancy. Silhouettes, generally, if you look at the heart, no doctor, the surrounding structures will provide a contrast. But if there is any pneumonia in any of the lung segments, that lead to loss of silhouette sign. So you should remember left heart border you can't see means lingular inflammation. I mean pneumonia. Right heart border is right middle lobe, left hemidiaphragm is left lower lobe, right hemidiaphragm is right lower lobe. I leave the literature for you. Loss of silhouette sign. So you want to evaluate posterior fossa tumor. It is the MRI, which is the best. Blind loop syndrome, where do you see, doctor? In Billroth type 2. So what are you doing in Billroth type 2? You are cutting through the half of the stomach and then you are connecting it directly to the jejunum and you are leaving the duodenum like a blind loop, and that lead to the development of growing of organisms and it develops the blind loop syndrome. Whenever you remove area of the small bowel, why do you get oxalate kidney stones? So you should remember, distal ileum is the place where fat absorption occurs. If you remove that ileum, then the fat which is not absorbed bind with calcium to the fatty acids. And that lead to the development of unbound oxalate getting absorbed too much, leading to hyperoxaluria and oxalate crystals. In Graves' disease, what you have is thyroid stimulating antibodies, not antithyroid. Papillary thyroid cancer, they're all poorly encapsulated tumors. In primary hyperparathyroidism, older people with mild hypercalcemia, they do not need surgery. Whereas urinary stones, marked osteoporosis, marked hypercalcemia, they're all indications for surgery whenever the patient has got primary hyperparathyroidism is what you need to remember. A patient presents with Cushing's syndrome, raised plasma cortisol, increased urinary cortisol. You are unable to suppress cortisol with dexamethasone suppression. ACTH is low. They're all significant of adrenocortical adenoma. So whenever there is a hypercortisolism, it can be due to pituitary tumor producing too much ACTH, or it can be ectopic ACTH production, or a adrenocortical adenoma producing excess steroids. But if it is the adrenal, then that will suppress the ACTH in the produced by pituitary. So low ACTH is a significant feature of adrenocortical adenoma. 30-year-old lady, recent onset of lump in right breast. She is no axillary supraclavicular lymphadenopathy. So if there is no breast lump, whenever breast lump is there, you can treat with aspiration. If the cyst content is blood stained, then you need to do excision. If there is a residual lump after aspiration, then also you should do a excision biopsy. Carcinoma in situ in the breast. Mastectomy is curative. It is multifocal bilateral. It can be detected with mammography. They're all true. Patty type of modified mastectomy does not remove the major, doctor. Earlier radical mastectomy, we used to remove the pectoralis major, but major is not removed. That's a point you need to remember. Thymoma is treated only by thymectomy. I'm going very fast, but I'm assuming that you all have solved the question paper in the score app, the mock test. If you did that, then this discussion will not look too fast. Okay? So, after blunt injury to the chest, patient has a large flail chest with cyanosis. So here you have a flail chest that is endangering life because of cyanosis. So here you need to do endotracheal intubation. Between acute MI and elective surgery, at least 6 weeks time should be there. Coactation of the aorta, most commonly proximal descending aorta. Below knee amputation for Burger. The combined length of anterior and posterior skin flap should be at least 15 centimeters to allow for some edema. Raynaud's disease, sympathectomy has not much of role. Nifedipine has got a role. 45-year-old, 5 centimeters subacute mucosal leiomyoma. So it is surgical enucleation is the treatment. Small tumors can be removed by endoscopy. So after esophagectomy for cancer, the stomach is mobilized and connected with cervical esophagus. Now, how does it get the blood supply? It is the right gastroepiploic artery which will provide the blood supply to that remnant of cervical esophagus is what you need to remember. Type A, type B gastritis. Type A is autoimmune. It has achlorohydria, hence hypergastrinemia. And the risk of gastric cancer is increased in type A. A patient has duodenal ulcer, he requires surgery. Which is having least recurrence rate. Truncal vagotomy with anthrectomy has the least recurrence rate is what you need to remember. You have done vagotomy, gastrojejunostomy for peptic ulcer. Now the patient is having bile vomiting. If it is not settling down, what will you do? Roux-en by diversion of the afferent limb of the gastrojejunostomy is the most effective way to deal with the persistent biliary vomiting. And you divert the afferent loop of the gastrojejunostomy to a point distal to the gastrojejunal anastomosis. That's what you need to remember. Now, the H. pylori associated with cancer of the distal stomach, not the gastric fundus. In Butt-Chiari, caudate lobe become hypertrophied. The entire segments of the liver, they all drain first into hepatic vein and then into IVC. Only caudate lobe directly drains into IVC without draining into hepatic vein. So Budd-Chiari syndrome, where hepatic vein thrombosis is there, then the entire liver go to caudate. Caudate will drain into IVC and it bypasses the hepatic vein, which is blocked. That's what you need to remember. I'll show you. This is IVC, doctor. So we are talking about the liver. So from the liver comes the hepatic vein that drain into IVC. But caudate lobe is one segment which directly drains into the IVC. So any hepatic vein thrombosis, which is called Budd-Chiari, all the lobes of the liver go to the caudate and caudate directly drains into the IVC. Hence, caudate lobe hypertrophy, not atrophy, is a feature of Budd-Chiari. Multilocular cyst in right lobe of liver. So that is very typical of Echinococcus granulosus, and serology will be positive in nearly all cases. Asymptomatic 4 centimeter splenic artery aneurysm. What do you want to do? Typically, splenic artery aneurysms can occur from previous pancreatitis or from atherosclerosis. Most of these aneurysms are single, is what you need to remember. A 3-year-old boy, intermittent jaundice, splenomegaly, there is hereditary serosinosis. What should be the treatment? You need to do splenectomy after the age of 6 years, so that the risk of post-splenectomy infections can be minimized. Fusiform choledochal cyst. You need to do excision of the cyst and do Roux NY hepatico-jejunostomy as the treatment. Gallstones are there. Ultrasound is showing 2 centimeter polyp. How do you want to manage, doctor? Laparoscopic cholecystectomy. 40-year-old female presents with high-grade fever, jaundice, and right hypochondrial pain. So that is all suggestive of cholangitis. First to treat with antibiotics. If there is no response, do the CVD drainage. And you will do CVD drainage using the ERCP, endoscopic retrograde cholangiopancreatopathy, and then do the stenting. Primary duodenal diverticulae. Usually they do not bleed. They occur in the inner part of the second and third part of the duodenum. Toxic megacolon means more than 6 centimeters. Fracture neck of femur, attitude is flexion, is external rotation. And there's also shortening. 50-year-old, hip and fracture X-ray show 2-part intertrochanteric fracture. Lesser trochanter, greater trochanter, intertrochanteric fracture. So this patient should undergo internal fixation of that intertrochanteric fracture with a dynamic hip screw, is what you need to remember. Fracture of the tibia. Intramedullary plating is the treatment of choice. Typically, it happens between proximal 2/3 and the distal third. In ankle sprains, the usual cause is an inversion injury that injures the lateral collateral ligaments. Total hip replacement. 70-year-old man with senile osteoarthritis, young patient with juvenile arthritis, they're all the indications. Not a 30-year-old because of the osteoarthritis, because process life itself is around 5 to 10 years. Now, in which patient arthritis of the hip, total hip replacement is indicated? A 75-year-old with marked pain, poorly controlled analgesic and physiotherapy, you need to relieve that. Dramatic results will be there if you do total hip replacement. A 70-year-old male, mild hypertension, is to undergo total hip replacement, total knee replacement. So, most important thing, infection is the biggest killer in orthopedic surgery. At least 3 doses of broad spectrum antibiotics you need to give before operation. And low molecular weight is used immediately prior to induction. A 20-year-old male presents with history of pain in the right leg and gives a past history of open fracture. There's a draining sinus. You need to do plain X-ray. They will show sequestrum and bony irregularity. Osteochondroma is commonest benign bone tumor in people who are below 30 years of age. So, doctor, with that, we reach the last question for today's evening. Osteogenic sarcoma presents like a painful swelling, sclerotic lytic lesion in metaphysis, typically in the second decade, and the commonest site is knee and shoulder. So, doctor, thank you so much for giving your time on this pleasant evening. Every day we meet, 3 to 4 hours we'll study together, and one day we become NEETPG topper and show the world that you are born to become a great cardiologist, neurologist, neurosurgeon, nephrologist. Have that dream in the heart and study every day. You have Dr. Murali Bharadwaj to hold your hand and take you to the counseling to make you the topper. Thank you very much.